Okay, this is part 2 of the cardiopulmonary lecture for Clinical 2. We are starting on the electrocardiograph leads. This is really easy. You just got to roll with it. The EKG is going to consist of 12 leads. A lead is the actual tracing of the electrical activity of the heart between two electrodes. So we have leads, we have electrodes, all these cool new terms. So each lead provides us basically a picture or a photograph, as the slide showing, of the heart's activity from a different angle. This results in about 12 pictures of the heart. So we're looking at all different angles, like we were trying to go around and take a CAT scan or an MRI type of picture. So we have 4 limb wires. We have the right arm, the right leg, and the left leg. Well, what's important here is that you understand that the right leg is our grounding lead. So it does not serve for any reason for recording, but it only serves as an electrical reference point to ground for our electrical procedure that we're doing. Okay. So the chest lead wires, they're actually abbreviated with the Roman numeral or the letter V, and they use 6 chest electrodes. Alright, so what the heck is an electrode? An electrode is made up of a substance that's the good conductor of electricity. So you've got to remember, what are some good conductors of electricity? So liquids, gels, those types of things, and that's what we have. This is actually a sticker with some electrolyte on the back of it. And that's what we're going to learn a little bit more. But the electrode actually picks up the electrical impulses given off by the heart, and it takes it to the lead. So there's amplifiers, which are devices that are located in that machine that actually amplifies the electrical impulse. Then we might see that some of those things come from this percentage of voltage to this percentage of voltage. So we can see large and small. Alright, so sometimes we have to make them bigger, and that's where we actually change a little bit, and we kind of change the voltage by adjusting the galvanometer. This is what's going to give us the better picture. Okay? Alright, so let's talk a little bit more about these electrodes. They are used on a resting 12-lead electrocardiogram. So this is one that just sits still, not like a portable one. That's why it says resting. They contain a thin layer of metallic substance, which is the good conductor of electricity. They're square in shape, and the tabs extend from one end, and there's a little bitty flip at the end that you can actually attach that little electrode to it. They typically have like an alligator clamp to clamp onto the electrode and the lead. The Electrolyte Gel, which I spoke about earlier, is combined with an adhesive, and basically we've got to make sure that that sticks well to the patient's skin. Sometimes it doesn't, and you can probably think of reasons why, but let's talk about it. The patient may have lotion on. They may have become very sweaty or diaphoretic. They might be very hairy. So there's reasons why we have to work with this. If a patient has a very oily or wet appearance to their skin, sometimes you might have to wipe that off with some alcohol and a washcloth, so you can make sure that the electrode and the electrolyte is going to stick to their skin. Sometimes you might even have to use a little piece of tape, and that facilitates the adhesion as well. Alright, and then we're going to use the 10-fold pouch holds that 10 electrodes that we're going to stick on the patient's chest and arms and legs. But believe it or not, these things have an expiration date, so we got to be very careful. The ones that you got in your kit very well could be expired, and you will be able to tell when we start actually putting these on our patients or your classmate whether it's going to stick or not. So we've got to be careful when we're in their office and make sure that those expiration dates are within date. If not, it has to be thrown away and get some new ones. Alright, so this is going into more of how we have to store the electrolyte gel and the leads. And this is really important when we talk about the bipolar leads. Remember, bi is going to be 2. So let's talk really deep about this. You have leads 1, 2, and 3. Each bipolar lead that's used, it has 2 limb electrodes to record the electrical activity of the heart. Remember, lead 1 is going to record the electrical activity between the right arm and the left arm. So that's going from right to left, straight across from the arms. Lead 2 is going to be between the right arm and the left leg. And lead 3 is going to be between the left arm and the left leg. So 1, 2, and 3. Lead 1 is going to go from right arm to left arm. Lead 2 is going to be between the right arm and the left leg. And then lead 3 is going to be between the left arm and the left leg. Okay. Now looking at lead 2, this is going to be one that you can see more clearly than others. So there's going to be times when your doctor says, hey, I want you to run me a rhythm strip. And it is going to be just recording lead 2. So if you remember back from our previous slide, lead 2, remember it's going to record between the right arm and the left leg. So that's what you're going to be reading if your doctor asks you to give them a rhythm strip. So AVR, which is the augmented voltage of the right arm, it's going to be recording electrical current traveling between the right arm electrode, and that's going to be to a center point between the left arm and the left leg. It's also going to read a left arm electrode to a central point between the right arm and the left leg. And then it's also going to read the left leg electrode in a central point between the right arm and the left leg. Then you have your augmented leads of 1, 2, and 3, then your AVR, your AVL, and your AVF. Alright, so let's talk about these chest leads. Remember, V are going to be for your chest leads. So V1, V2, V3, V4, V5, V6. So this is going to be looking at the heart from front to back. So from anterior to posterior. So looking at that heart from the inside. Okay? So these leads have to be placed appropriately. You've got to be able to check those intercostal spaces, fill those intercostal spaces, and place those electrodes in the right places. And that's going to be something that we'll work on with our skill for EKGs. And don't worry, it's something you build that skill on, and it typically comes a little easier the more that you do it. So what you do need to remember is that normally we're going to record an EKG with the paper moving at a speed of 25 millimeters per second. So 25 millimeters per second. Now let's talk about the placement of these V leads, these chest leads. So V1 and V2 are going to be placed at the 4th intercostal space. V1 is going to be on the right margin of the sternum, and V2 is going to be on the left margin of the sternum. Then you're going to come to V4 to place your next lead, which is going to be at the 5th intercostal space at the junction of the left midclavicular line. Typically that's going to be about nipple line, and that's going to be the 5th intercostal space, so a whole intercostal space down and over. Then you'll come back and put V3 between the positions of 2 and 4. So you start out by putting V1 and V2, then you come and do V4, then you come back to do V3. Then once you have V3 in place, you come and do V5, which is going to be horizontal to the level of position 4 and at the left anterior axillary line. That's going to be, remember the axilla is the armpit, and then V6 is going to be at the horizontal left level of position 4 at the left mid axillary line. So yeah, that's a lot of words, but what you're really wanting to do is learn how to get started. So you have to count down to that 4th intercostal space. and depending on if you count down on the right side or the left side of the patient's chest, you'll start with either 1 or 2, and then you'll use that space and just count down from that. Don't try to reinvent the wheel and go all the way back up and count all the way down again. Leave your finger there and then fill the next intercostal space, but come over to the nipple line or the midclavicular line to put that V4 down. So, what does the patient have to do? We got to remember, we got to prepare our patient, tell them how to be best prepared for this ECG. So, why don't the leads stick sometimes, or the electrodes stick? Because of body lotion. So this is what we're going to do. We're going to tell them, don't wear body lotion, no oils, no powder for that day, because powder will oftentimes make the electrodes not adhere to the skin as well. They need to wear comfortable clothing so they can get in and out of it. If they wear a button-up blouse or shirt, that one is easily removed and they can kind of open it and then put it right back on. And then women should not wear full-length hosiery, because we're actually going to have to put 2 electrodes down on their legs. So these sweet little old ladies that always dress to the nines because they're coming to the doctor's office, we want to remember to tell them, don't wear full-length pantyhose. You could wear your trouser socks or your knee highs, and we can roll those down. Okay, we've got to make sure that we frequently clean that ECG machine. Be careful, nothing real caustic. Alcohol and maybe a washcloth are real good. Don't want to mess that up too bad. Okay, so maintenance. We've got to be careful to make sure that all those wires and the electrodes that, the leads where they're clamping together with the wire, make sure that those are functioning properly. If they don't fit together nice and secure, then you're not going to be able to get a good reading. So each time you do your ECG, you should be able to check all those lines at that point to see, hey, I've got a problem here with one of these chest leads and I really need to get this fixed. If they have fraying or cracking, you need to take those out of service, because we surely don't want to get electrocuted, nor do we want to electrocute our patients. Okay? Make sure that you check the metal tip of each lead wire for the adhesive or electrolyte gel residue, because sometimes if that's left on there, it can cause some interference, or it might even get in the way of the next one being able to securely adhere to the patient's new electrodes. So we don't need any more trouble than what we've got. Alright, so let's see where we're at with this recording. Let's stop here and then we will go into the next portion.